Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to our weekly news conference for the latest in COVID-19 information for the community. We do these every Wednesday at 11 a.m. Let me go ahead and introduce very quickly who is on our panel today. We're joined by Amarillo Mayor Pro Tem Howard Smith, Casie Stoughton, Director of Public Health, City of Amarillo, Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center, Dr. Brian Weis, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Lamentier, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. We're going to open up to our panel to make statements, and then we'll take questions from our media members who are in attendance. Let's go ahead and start with Amarillo Mayor Pro Tem Howard Smith. Mayor Pro Tem, how are you today?
I'm good. Thank you. Appreciate the opportunity to be here. I'm filling in for the mayor who couldn't be here today. Unfortunately, we changed to level red this morning, and we'll get into more explanation about that from the panelists. But on a personal note, I want to make a statement. I'm a veteran. I go to the VA hospital. They've been taking care of me for several years. I appreciate it that they're located right here in Amarillo. I can get to the VA in 10 minutes, but they cover, I think, at least the Texas Panhandle and more, and do a good job. They have a way of calling members and getting over, I think it's over 3,000 people that depend on that hospital on the phone in one time and give a report, probably a 30-minute report or so, where people can ask whatever question they want to ask. So I personally want to thank the VA for doing that. Also, Northwest and BSA does a good job of screening people. I know getting into the VA, they asked me, seemed like 1,000,000 questions, and that's okay. And once I get through those questions and then I get to the door, they take my temperature and they're doing all kinds of stuff, which we need to follow. We need to follow the doctor's orders, and we've got to work on that more. Washing our hands, distancing, we've got to do those things to head off this level red. So let me just turn it over to, I think that's all I need to say. We'll turn it over to David Henry, the next person.
Thank you, Mayor Pro Tem. Let's now go to Casie Stoughton, Public Health Director for the City of Amarillo. Casie, how are you today?
I'm well, Dave. Thank you. I'm glad to be here this morning. Like our Mayor Pro Tem said, we have moved to level red. And so we do have a few things to talk about this morning. I'll first go into the numbers, and then we'll talk about what level red means. We also need to talk about the GA32's new calculation of the hospital percentages for our 25 county regions. So we have a little bit to cover this morning, so we'll jump right into the numbers. So as of yesterday, there were a total of 10,777 total COVID-19 cases for Potter and Randall counties, 6,822 cases in Potter County, 3,955 cases in Randall County. We have a total of 7,380 recoveries, and we are up to 131 deaths reported in our community. That leaves us with 3,266 active cases here in our community. Each of the cases do represent a unique individual. The total rolling 7-day positivity average for Potter and Randall County is 14%, and the positivity rate at the drive-through testing site is at 37%. The public health drive-through testing site does remain open, and individuals can call 378-6300 to be screened and directed to the drive-through testing site. Locally, we are seeing a significant increase in cases and a surge in hospital capacity. Public health, city leadership have discussed the need to move back to the status red, which we did so this morning. We've been working with our communications team, the city manager's office, our public health authority, and our local medical directors at the hospitals to determine which criteria we need to use to shift between those statuses, especially the status level red. We have made a few minor updates to the status level chart, which can be found at AmarilloAlerts.com, and that those updates are in accordance with the governor's orders and with our local restrictions or our local recommendations. We've also developed that objective set of criteria to determine when we will need to move between indicators. Red, when we move to level red, that would be when we are at an adult bed utilization over 80%, when our ICU utilization is over 80%, our ventilator utilization is over 50%, and when our 5-day COVID-19 case average is over 80 cases per day. And right now we're at, this week, our new case per day average is at 214 new cases per day. And so we did move to that status level red this morning. We have specific guidance and criteria for the level orange, yellow, and blue, and that can be found at AmarilloAlerts.com. Once we move to level red, we'll stay at level red for 2 weeks. There'll be an automatic expiration at that 2-week mark where we will reevaluate. If conditions are still at level red, then we will move back to level red, so there'll be another level red issued at that time. The status will be reevaluated on a 2-week basis until conditions allow us to move back to level orange. Like I said, based on these metrics, we moved to level red this morning, and all of the communications tools have been updated and have been placed on AmarilloAlerts.com. The report card was also updated to include what that status level red means and what the recommendations are that you can follow to keep you and your family safe. There's a poster that's also been updated there on Amarillo Alerts that can be downloaded, so that if at your business or your place of work, you can post that there, so that the tips and the reminders of what status level red are, that can be used wherever you need it. So moving on to the GA32, the governor's order GA32, that takes effect today, but it does supersede GA30. And one of the main updates to GA32 was it changed the calculation to the percentage of the hospital percentages that are reported out for our 25 county RAC region. GA30 calculated the number of COVID-19 patients hospitalized as a percentage of all hospitalized patients. GA32 changes that calculation and now calculates the number of COVID-19 patients hospitalized as a percentage of the total hospital capacity. So you can see that with that denominator expanding, the percentage has decreased for our 25 county region, and we're no longer at that 15% threshold. So under the GA32 calculation, yesterday's percentage was at 11.54%, which is just over Tuesday's percentage at 11.41%, and Monday's, which is at 10.44%. So again, you can see that that hospital capacity is certainly stressed, regardless of the way the state is calculating that percentage. With regard to local spread, we don't have any identified hotspots or large outbreaks. We just have lots and lots of community transmission, which is again another reason why we had to move to level red. Lots of spread at youth sports teams, birthday parties, workplaces, family get-togethers. We just have a lot of gathering here in our community. I think we do have decreased mask wearing and decreased social distancing. So just really want to encourage our community, especially as we've moved into level red and we have stress on our hospital systems, to be mindful of that, to really wear our masks, be thoughtful about the space that we have between each other, and to increase that space that we have. Good hand washing is always important, and disinfecting of surfaces. Again, we have lots of different communications tools. Our communications team has been working very hard. We have lots of new videos and handouts on our website. We have handouts about if you have tested positive, or if you have been exposed to COVID-19, or if you think you might need a test. There are handouts and different videos to help kind of guide you through those situations. So please visit AmarilloAlerts.com and check out that information if you have questions about COVID-19 and what that means in your family. And that's all I have today, Dave.
Thank you, Casie. Now I'll go Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center. Dr. Milton, good morning.
Good morning. Thank you, Dave. Casie, that was great. And not much else to add there, just that once again, these numbers reflect increasing widespread community transmission, hence level red. If there's any silver lining at this, it's that the ventilator use has increased, but not proportionately so. And I'm going to let Brian and Michael talk about that a little bit more. But as said before, there's important things that I'm going to repeat again, as I've had almost every week. You have to wear a mask. That's the most important thing, is wearing a mask. You have to practice socially distancing. You have to avoid crowds. If you look at the wording between level yellow and level red, the key word that I see is the difference between limit and avoid. So you need to avoid crowds. Outdoor activities are better than indoor activities. I'll remind everybody, the first cases that we had here in town 6 months ago had to do with a basketball tournament. And we had many individuals from a county outside of Potter Randall County who became very ill. Some died. And it's very important, I think, if you're going to a gym or any indoor space, you have to wear a mask and socially distance. If you're sick, stay home. Do not go out. And finally, wash your hands. So without further ado, I want to go ahead and let Brian and Mike have more time here to talk about these really alarming numbers at the hospital. Thank you.
Thank you, Dr. Milton. Now I'll go Dr. Brian Weis, Chief Medical Officer for Northwest Texas. Dr. Weis, how are you today?
David, I'm flabbergasted. Basically at the state's oversimplistic calculations when it comes to COVID-19. So, and I'm talking about specifically about using the total hospital capacity, because that's misleading for several reasons. First, if you're using that number, you're talking about our total licensed beds. And what that means is that they're assuming that all those licensed beds can somehow be utilized for a COVID-19 surge. And that's simply not true. So, for example, if you look at Northwest, we have 495 licensed beds. That includes 106 behavioral health beds, includes 32 neonatal intensive care unit beds, includes 44 beds for peripartum ladies and their newborn infants. These are not beds that can be recruited for COVID-19. So by using that number, that overestimates our capacity to handle COVID-19 patients. Second, Dr. Lamatier and I have spoken frequently about the fact that critical care is by far the most crucial resource in the hospitals right now. We know that COVID-19 can primarily make an adult very sick and need critical care, but so can trauma, heart attacks, strokes, or other serious infections. So if our critical care unit is full of people suffering from COVID-19, I cannot recruit a labor and delivery bed to take care of someone with a heart attack that comes in. So again, critical care is a very limited resource for both hospitals. And finally, basically, just because you have a bed available doesn't mean you can use it if you don't have a highly trained staff member to help take care of the person in that bed. Right now, Northwest Texas has 50 employees quarantined. So our staffing challenges are now starting to outweigh the actual number of beds we have in the hospital. So every morning this week, we have had patients waiting in our emergency room for a bed, meaning that we do not have the immediate capacity to get them into an inpatient bed. For example, this morning we have 239 patients in the hospital and we have ED holds. That number 239 really reflects our capacity right now, not 495 licensed beds. So I think that's a difference between these numbers we're talking about. So let me give you an example. Let's go to our numbers today. So we have 60 positive patients in the hospital today. We have 20 in the MICU. That is our full MICU capacity right now. And 7 of them are on ventilators. We have 15 of our 40 ventilators in use right now. Now, if I do the governor's calculation and say, let's put 60 over 495 or licensed beds, I get percent positive of 12%. Now, what if I actually remove some of those units that just can't be used for COVID, like the behavioral health unit, the NICU, or L&D, and I do that calculation, I then get 19% positive rates. However, if I look at our capacity today as saying this is all we can handle today, 239, I get a positive rate of 25%. So you can see how that denominator makes a big difference, but I think that last number really reflects right now where we are as a hospital, that we don't have 495 available beds. We really have 239 right now as of today's numbers, and knowing that we have some patients waiting for bed. So it makes a big difference. Yesterday, we tested 173 patients, outpatient. We had 23 positives. We are averaging about 13 to 15% positives every day right now. Just to remind you, back midsummer, we were below 10% on daily positives. So we are seeing that go up. In terms of remdesivir, right now we have 26 patients on remdesivir. We have enough to treat another 26 patients, but we are very anxiously trying to acquire more of this medication because we are moving through it pretty quickly as we increase the number of patients on this. As I mentioned, we have 50 quarantined employees right now because of either positivity or significant exposures to COVID. Again, 3 weeks ago, that number was typically 14 to 15. So we're up to 50 right now. And that obviously represents challenges in terms of staffing for our units. Obviously the city's gone to red. As a hospital, we are also making new changes to try to protect ourselves from some of this surge. In terms of visitation, we've gone from 2 visitors per room down to 1 visitor per room from 8 a.m. to 8 p.m. And we're not allowing visitors to patients with COVID-19. We may still further restrict those visitation allowances if the surge continues. So the take-home message is no one wants to see the city shut down again. And I can't not imagine the anxiety and frustration of people who own small businesses like bars and restaurants and other small businesses having to deal with this surge now with the fear of us shutting down. And I can tell you, as a bass player for a rock band, I want to see the bars open and stay open so I can start making more noise again. Hey, but there's no easy solution here. We want to support our neighbors who provide these services to our community. Then we have to wear a mask. We have to keep our distance. We have to wash our hands and do those things that we know can reduce the spread of this virus quickly. That's all I have today. Thanks, Dave.
Thank you, Dr. Weis. Let's now go to Dr. Michael Lamontier, Chief Medical Officer for BSA. Dr. Lamontier, how are you?
I'm good, David. Thank you for the introduction. Well, folks, I think you've heard the initial reports coming from our health experts, and I'm going to add some more commentary that I'm certain that Dr. Gonzalez will as well. But bottom line is, we continue to break records at BSA, and when it comes to COVID-19 over the past week, and that is not a good thing. We are breaking records in terms of the number of confirmed cases of COVID-19 that are requiring hospitalization at our facility. Today, we're up to 82 patients hospitalized at BSA with confirmed infection. If you combine that number with Dr. Weis's number at Northwest, that's 142. And then we're going to be able to add what Dr. Gonzalez will tell you as far as the immediate hospitals in the Amarillo area that are taking a large share of this burden and trying to manage this acute population that is quite ill with COVID-19. Just to put it in perspective, the comments that Dr. Weis made about how the state has readjusted the calculation to look at hospital strain, it's problematic in our eyes as well. Our total census in the hospital today is 298 patients. So that means that right now, 28% of our entire inpatient volume is secondary to COVID-19 as the primary reason why they're admitted at this time. Now, that is a high number. That is a concerning number. For our hospitalist physicians that manage many of these inpatients, yesterday when we were having our meeting, it was known that a third of their inpatient census was due to managing COVID-19 patients. The stats on the composition of those patients, as Dr. Milton mentioned, if there's a little bit of a silver lining, it's the fact that it looks like less of these patients, at least in our more recent data, compared to when the pandemic first hit us, less of them are requiring ICU beds. Thank God, because if they were requiring ICU beds at the clip they were back in the spring, we would right now be having to ship patients out of Amarillo, I'm fairly certain. So again, 28 out of the 82 patients are in the ICU, and 13 of those at BSA are on the ventilator. We are attempting to utilize more high flow oxygen, as I've said, over the past several weeks, which has been working well. And our critical care doctors and our medical physicians that are the hospitalists and Texas Tech physicians are doing a great job with managing those modalities and keeping people off of ventilators. Fortunately, we have been able to do things to help improve our equipment needs and our PPE since the spring. So we are only at 43% of our ventilator capacity. But again, just because we have those ventilators doesn't mean that we have the staff and the physicians to manage patients if we were at 100% utilization of those devices. We've got to have nursing staff to manage these patients. In fact, because of our pleas to the state, we have been provided some RAC nurses, which has been a godsend. We got those this week. We had 16 nurses from the RAC, and we also got 6 respiratory therapists to help staff our facility and take care of this large burden of COVID-19 patients, in addition to those that are non-COVID-19 and that need acute care services. Similar to what Dr. Weis mentioned at Northwest, we have 69 staff members currently on quarantine. Now, fortunately, only 29 of those are nurses, but those are 29 nurses that we had to remove from the workforce transiently so that we can get them through the appropriate quarantine period as outlined by the CDC, and then reinstitute them back into the workplace when we know it's safe for them to do so. That affects our ability to manage patients in the hospital when we're having a large number that get quarantined. And the majority of our staff that are getting quarantined are not because of work exposures. They're because of exposures in the community. So again, I even commented to our leadership group today on one of our regular meetings that we have on early Wednesdays that our folks are less at risk of getting COVID-19 in the hospital than they are in the community at this point. And the reason for that is our staff are being very diligent about adhering to the PPE. And that is wearing masks, that is wearing appropriate protective gear so that they're not exposed. It's really those situations when you're back in the community and we're letting our guard down a little bit. And I think we've all been guilty of that at times since the outset of the pandemic, which is increasing our risk. And again, it's important for us to be diligent now with going back to those practices even more stringently, I would argue, than we may have been doing at the outset of the pandemic. Because again, the prevalence is much higher now than we were seeing previously. The number of confirmed cases in Potter and Randall counties per 1,000 persons are on the steady rise. They're not on the decline. So we have not yet peaked. We're all concerned about when we are going to peak. We're all concerned about the ability to have resources to manage the peak. And we're going to continue to work hard to do so that we can take care of our community. But we do need your help. And we appreciate when you're abiding by the restrictions outlined. I'll make a couple comments on drug therapy, remdesivir. We now have had, for our total inpatient population, 80% of those patients have received remdesivir. So we know we can use that drug for all patients that are hospitalized, but we're following criteria and making sure that patients don't get the drug when they have a contraindication, which means they have either a liver problem potentially or kidney problem. And sometimes the patients are here for a briefer stay. So they may be lucky enough to have a mild course and can go home before they even need to have a significant course of that drug therapy. We treated over 260 patients with remdesivir here at BSA, and we have ongoing supply to continue to do so. We're using steroids on the appropriate patient population, and we've treated over 500 patients with dexamethasone. And those two drugs, I believe, have been the mainstay behind why we're seeing some better responses to therapy, and we're saving more lives as our clinicians choose to use those medications. We are still enrolled in the Regeneron trial. We have 33 patients that have been enrolled to date. It's still too early, I think, to know whether or not that drug therapy is going to be effective in terms of the statistics. But we are complying with that trial and effort to try to help give that information back to our medical community across the state and across the country. And I think that it's important for us to mention that we have gone back to restricted visitation more so as of this week. We're down to one unique visitor per patient per day. And again, that is an effort to protect our staff, to protect other patients, and to reduce the risk of potential unnecessary transmission in the hospital. We are not required to restrict elective procedures at this time, but we are carefully looking at our schedule for the OR and other procedural areas and making sure that we're having appropriate discussions with physicians as we scrutinize that schedule to determine if cases can and should be postponed to a later date. Many of them cannot, and when they cannot, we are not asking physicians and patients to reschedule. But when some of them could be rescheduled and it's appropriate to do so, we're letting the physicians of those patients take the lead and help us make those determinations. And it's critical that we do that so that we maintain the ability to have patients utilize inpatient beds when they need them, secondary to and subsequent to a procedure that was scheduled. So that's really the update that I have now. The last thing I will say is if you haven't got your flu shot yet, the question I would have is, what are you waiting for? Please do so immediately unless you have a valid contraindication. We're not even at the onset of flu season yet based on our testing isolates at BSA, and we are starting to have this surge. So again, once we start to have flu season hit, we have the potential for a even more significant scenario here. Thank you.
Thank you, Dr. Lamentier. Now to go Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you today?
I'm doing well, thank you. So just to continue on with what Dr. Lamentier said, he had mentioned 142 within Northwest and BSA. Well, when you add the VA, we have 8 additional COVID positive patients. So that gives us 150 here in the Amarillo hospitals hospitalized for COVID positive. Of those 8 that we have, 4 are on the ventilator, 4 in the ICU, 0 on a ventilator. And then we have 89 patients, veterans who were COVID positive, we're tracking that are on home isolation. If you remember last week, I reported that we had the highest number I'd seen, and it was at 50. So we have grown an additional, it was 50 something. So we've grown an additional 30 to 40 since last week. Want to just reiterate the same thing. The important thing that we've been saying all along of the importance of hand washing, wearing your face covering or mask, and social distancing. One of the things that we have looked at here at the VA, and the VA is how do we help this social distancing? And so there is a I Am Here application that the VA has come out with. And if a veteran is coming for an appointment and they just text the word here to 53079, it notifies us, the veterans here, allowing them to wait in their car, and then we can send them a message to give them directions for when to actually enter the facility. So similar to how some restaurants have done that, I know. The other thing I just want to reiterate the importance of the flu shot. Thank you, Dr. Lamentier, for mentioning that. It is important to get for our veterans. We do have it. All you have to do is come to your primary care and we can make sure you get vaccinated. I do appreciate all the veterans who showed up to our flu drives we've had, but we do have it continue to be available in our clinic free of charge to qualified veterans. Last thing, and I sometimes mention things that we have going on special this week. So this week happens to be National Special or Sterile Processing Week. And so just a shout out to all those at all the facilities that make sure that we have sterile equipment to work with, sterile supplies, and to make sure that we are doing things in a safe environment. And then last, today is National Emergency Room Nurses Day. What a day, what a time to shout out to those emergency room nurses who not only are dealing with what comes into the ER, but as mentioned by Dr. Weis, often having to hold patients longer than they would because of capacity at hospitals. And so really want to give a shout out to them. And once again, thank you, Amarillo, for this opportunity to talk to my fellow veterans.
Thank you, Dr. Gonzalez. Just on a related note, can you explain how a veteran might get a COVID-19 test at the VA?
Yeah. So what will happen is, first of all, a veteran can call. If they do not have symptoms, they can actually talk to our phone area. And then what they'll do is determine whether or not they need one. And if so, they can set up an appointment. And there are some drive-through locations set up to get COVID testing. That's for asymptomatic. If somebody has symptoms, we schedule them to come in here. And then when they screen, what we say screening positive, remember all those questions that the Mayor Pro Tem mentioned being asked when you come here, we then send you to a special area. They used to call it the COVID clinic. I didn't like that name, and they started calling it the CSU COVID screening unit. I only like that a little bit better, but I came from Columbus, Georgia, where they have a CSU college. So that threw me off too, but they go there, and there what they'll do is they'll get additional screening, and we will conduct the test right there if needed. The nice thing is, and you haven't heard me say this much, is we have not had a lot of PUIs because we have been doing very successful in getting these tests back relatively quickly. So often we can get that veteran their answer, not while they're waiting necessarily, but we can get it in a very short time order. So hopefully that answers your question.
Yes, sir. Thank you for that information. Now go to City Manager Jared Miller. Mr. Miller, how are you today?
Doing good. Thanks, Dave. I just want to remind everyone that the drive-through testing center remains open. If you feel sick and you have symptoms you think might be COVID, call the public health hotline at 378-6300 to be screened for the drive-through testing center. If you're screened for the drive-through testing center and you're you're referred for a test, if you don't have a ride, Amarillo City Transit is providing free transportation for individuals approved for a COVID-19 test by the Amarillo Public Health District. Call Amarillo City Transit in this event at 378-3095 to arrange free transportation. Now we're operating under two primary executive orders from the governor right now, GA-29 and GA-32. GA-29 was issued by the governor in early July, and it requires every person to wear a face covering over the nose and mouth when inside commercial entity or other building or space open to the public, or when they're in an outdoor space, wherever it's not feasible to maintain 6 feet of social distancing from another person not in the same household. There are a few exceptions for that, but per 29, when we're out and about, we need to be wearing our face masks. That is consistent with all the guidance we've been hearing from all of our medical professionals on this call, and it is consistent with the governor's executive order GA-29. Still required to do that. With regard to GA-32, GA-32 superseded GA-30, which is the primary document which is guiding our reopening process right now. With GA-32, every business establishment in Texas can operate at no more than 75% of the total listed occupancy of the establishment. There are certain exceptions to that, and I'll go through that in just a moment. There's no occupancy limit for the following services: essential critical infrastructure, religious services, local government operations, childcare services, youth camps, recreational sports programs for youth and adults, any public or private school, drive-in concerts, movies, or other that type of event. Establishments that operate with at least 6 feet of social distancing between workstations, like cosmetology salons or tattoo parlors. In areas with high hospitalization, and we've gone over that with Casie Stoughton's very detailed explanation, any business establishment that otherwise would have a 75% occupancy or operating limit may operate up to only 50%. So if we ever do exceed that percentage that the governor has laid out in the formula in GA-32 that Casie went over for 7 consecutive days, we will move to an area of high hospitalization, which will reduce the operating capacity for many businesses, including restaurants and things like that, from 75% down to 50%. All indoor and outdoor professional, collegiate, and similar sporting events, including rodeos and equestrian events, shall remain limited to 50% of the normal operating limits as determined by the owner. Restaurants that have less than 51% of their gross receipts from the sale of alcoholic beverages and whose customers eat or drink only while seated may offer dine-in services. This includes bars that are temporarily operating as restaurants through a permit from the TABC. Bars that hold a permit from the TABC, Texas Alcoholic Beverage Commission, may offer on-premise services at up to 50% of the total listed occupancy of the establishment if the bar or similar establishment is not in an area with high hospitalizations. So if we ever do go into an area of high hospitalizations, any bars that have been allowed to open will have to close at that point. And the county judge or the county in which the bar is located files the requisite forms with the TABC. At this point, my understanding is that Randall County has done that and that Potter County has not. Patrons at bars may eat or drink only while seated. That's all I have at this point, Dave, and we'll be glad to answer any questions.
Thank you, Jared. At this time, we're now going to turn it over to questions from our media. You have a question for an individual panel member or the panel as a whole. That's completely fine. Let's go ahead and start with, if I'm not mistaken, Kevin Welch of KFDA News Channel 10. Kevin, how are you today?
Good. I'm good. Thank you. Say, Dr. Weis, just to back up a little bit, Dr. Lamentier said that BSA got rack nurses, has Northwest.
Yes, actually, we did, and I'm glad to hear BSA again. We have about 20 nurses from the rack, and I believe 2 or 3 RTs, but we've had them for well over a month. So I'm glad to hear BSA has gotten the same resource, because they're an invaluable resource for both hospitals right now.
Okay, and I guess, Jared, does the city have any location locked in for a surge of patients that in the spring? I guess we had a hotel lined up.
Yeah, we've exercised that just to make sure it works. We've got those protocols in place. Our biggest challenge right now is not necessarily space, but staffing. And I think our chief medical officers could go into more detail on that, and Dr. Milton as well. But yes, we have exercised those protocols, and we can stand that up at any time.
Okay, Dr. Milton, just trying to look into the near future, do you expect the high case count to continue for a while?
Dr. Milton, you're muted.
Sorry. Okay.
There you are.
Yes. To answer your question, yes, I do expect it to continue. It's unfortunate, because I think if people would wear masks, I think we could get a hold of it. But I've just been disappointed in what I've heard in the community of their compliance with that.
And Jared, can you explain why the level red doesn't affect the capacity of events? You have several outdoor events canceling voluntarily, but other ones proceeding, like in Hodgetown. And so can you explain the difference between the governor and the local red?
Sure. The governor's order does stipulate that any direction from a local municipality that is in conflict with the governor's order is invalid. So if we were to, the governor has allowed certain things to happen while we're in certain conditions that he's stipulated in there. So when we're in an area not high hospitalization, these things can happen, and we are not allowed to contradict that. The red is not necessary. Our condition red is a statement more of our local experience rather than the 25 county trauma service area that is used by the governor to measure our capacity. We do want to make sure that people understand the hospital capacity that we have available to us and the stresses that our hospitals are under. It's imperative that people take very seriously the challenges that have been articulated by Dr. Weis and Dr. Lamentier, because the more we can do to protect each other by wearing our masks when they're out and about, by limiting our social gatherings, by limiting our in-person meetings, the more we can wash our hands and sanitize our frequent touch surfaces, the more we're going to do a better job of reducing the number of people that are needing to be hospitalized. That affects us economically, that affects us from a health standpoint. They're all very important. But to your point, to your question, we are not allowed at this point to put out local orders that contradict the governor's orders.
Thanks. Last one, Casie. We have multiple clinics in town that are returning results on the day of testing. Do you expect the city to possibly move towards that? And if not, why?
So we do not have access to rapid test results, but the test that we do use is a local lab called PPL, and it's one that many of our local clinics use. And so our patients do have access to their results as soon as they're resulted through the patient portal, and they're given instructions on how to access that. And we have many patients who successfully do that. As soon as their results are released, then they can look on that patient portal and access their results.
Okay. All right. Thank all of you. I'm done.
Thank you, Kevin. Let's now go to, if I'm not mistaken, David Gay of the Amarillo Globe News. David, how are you today?
I'm all right. Good morning, everybody. I guess I have a question for the panel. I've seen multiple things on social media talking about, how the hospitalization rate has lowered, from Friday's, I believe it was 18% to the new rates that are being out there this week. What would you tell those individuals who may not realize that the rate has the formula has changed, and that individuals still need to be vigilant in taking those prevention measures?
So I think you did a great job. We would say many of those same things. The formula was changed, was updated with GA32. And so, but that really reflects a different calculation and answers a different question, especially than what we're experiencing with our local hospital capacity, and that we have moved to level red. And so we do ask people to avoid those non-essential gatherings. We have to do everything that we can to protect one another, to protect our families and our loved ones from getting COVID-19. We have had some of the 5 of the top 10 days of our total increases have occurred in the last 5 days. And so I think that we've had lots and lots of spread in October alone. And so we've got to remember those prevention tips. We've got to remember all of the things that we know that we can do to slow the spread of COVID-19 in our community.
David, I would say, any enterprise like business or medicine that follows a scientific process, you have to ask the question is the metrics we're following reflect our true concerns or our true focus? And I would argue that this number we're now following does not reflect the true focus, which is the fact that, yes, we have all these licensed beds, but those are not necessarily reflective of the beds that we can use to manage a COVID surge. And that's been the change. And so, on Friday, you mentioned the number was 18%. That number for Northwest today is 25% based on that calculation. Okay? However, if we're using the state's new calculation, then we're all the way back down to about 12%. So the problem is if you're comparing apples to apples, we went from 18 to 25% in the last week.
Absolutely. So I guess that goes into my next question. I guess for the hospital representatives in the room, do you expect within the next few days to hit that 15% marker?
I can start off with that response, and that is that we're very concerned about it. We are very worried that the rising incidence of cases in the Texas Panhandle, in our counties, in our city, and in our hospitals is going to continue. There's nothing that would suggest at this time that that's going to diminish. We're not even into flu season yet. We know that once we have flu season start, the expectation would be that things are going to get worse because there's the potential for co-infection with the flu and COVID-19, not to mention the other respiratory viruses and illnesses and infections that increase the number of hospitalizations that we see throughout the fall and winter months, just because of the natural course of those infections and disease incidents that we see in colder months. So again, we're very concerned about it. It just stresses and underscores the need for us to adhere to the practices that we know can mitigate the peak, just like we were talking back in the spring. How do we mitigate a huge peak in a short period of time? It's by distancing, it's by wearing masks, it's by doing those things to protect your neighbor, not just yourself.
David, I would concur with Dr. Lamentier. I mean, if we hit 15%, that means we've got to get to about 75 COVID patients with the denominator being 495. And in addition, like Dr. Lemtier was saying, we have all these other patients coming in with other ailments, a lot of them, critically ill, trauma, and things like that. We will be devastated if we get up to above 15%. And I'm concerned we'll almost get into almost a gridlock kind of situation in the hospital where we just won't be able to move patients in that sense.
Absolutely. That's all the questions I have. Thank you, guys.
Thank you, David. Let's now go to Aaron Langston of KAMR Channel 4. Aaron, how are you this morning?
Pretty good. And yourself?
Very good, thank you.
First question is, with the increase, are the hospitals having to turn away patients that they normally would take in, or are we still able to take in patients, especially from the outlying smaller hospitals?
I can start with the response there, and that is that yes, we have intermittently been on diversion over the past week, which is when we tell the surrounding rural hospitals when they're calling us about taking a patient that we have no ability to do so. That has not been a constant scenario. It's an intermittent scenario, like I mentioned, which means that we're constantly evaluating whether or not we can accommodate that patient from an outside rural facility, smaller facility typically, and that has to be evaluated based on current bed status at the hospital, how many occupied beds there are, what's our current number of ED holds, which means people that have been seen by our practitioners in the ER have been deemed to warrant a hospital bed need, but there's not one ready for them yet. So we're trying to get discharges out to get those ER admit holds upstairs. And then also those patients that are having procedures done that need an inpatient bed or a hospital bed, and trying to make room for them. Not to mention emergencies that sometimes happen where patients are in a lower level of care and need to be escalated up to the ICU. So we're constantly evaluating those things, trying to have appropriate throughput to get people discharged timely and appropriately. And yes, there are times when we've had to go on diversion and tell our neighboring facilities, we can't take your patient.
Yeah, and the answer is the same at Northwest. We have also had to decline transfers. Now, because we are the trauma resource in the area, we continue to take trauma patients and basically severe heart attack and stroke patients. And that's a delicate balance, because we've always got to allow some capacity to be able to take those trauma patients and those other critically ill patients. And so sometimes it does necessitate for us to decline some of these regional facilities, particularly over the last couple of weeks, knowing that we just have to be ready to be able to take the trauma patients and these other severe patients.
Alrighty. And has there been any discussion yet from the hospitals on stopping or lessening the non-emergency or elective procedures that y'all restarted a while back?
As I mentioned earlier during my brief update, we have not stopped elective procedures as any type of automatic ban. We are not at the level that we're required to do so, but we're proactively evaluating the schedule ahead of time, ahead of the week that's upcoming, to say what cases could we potentially ask the surgeons if their patient is stable enough to have the case postponed. And we've been able to have some cases moved. We've had some patients that have actually canceled their procedures, probably out of concern themselves. But again, it's a situation where we are absolutely taking measures to look at what can and can't wait, and trying to make good decisions about whether something can be appropriately rescheduled for a later date.
Yeah, it's the same thing. If you think back in March and April, part of the reason we stopped elective procedures was because of a lack of personal protective equipment, PPE. I think that concern is largely gone now. I think both hospitals have done a great job of accumulating lots of PPE. But then I'll echo what Dr. Lamentier says. Now the concern is, do we have a bed available for someone who needs an overnight stay or 2 overnight stays for an elective procedure? And that's the limitation now. So we've kind of changed. One of the governor's orders a while back said that you could restart elective procedures if you maintained at least 15% capacity for COVID patients out of your total available beds. I'm not sure that order, that we're still following that order, if that's the order still active, but that was part of the thing that the governor wanted us to do. But our concern is, just like with Dr. Lamentier and BSA, is do we have beds to accommodate these elective procedures? And we're looking at that also.
All righty. Next question. Early on, when we were in the first surge and our hospitalization numbers were pretty high, there was talk of partnering with the VA and using some of their open facilities at that time. Is that still on the table?
I think that all of those options are potentially on the table. As Jared mentioned, our city manager, the use of an outside resource, and whether that be a hotel or other, those plans have been made and they are being reviewed. I think that obviously the difference between the spring and now was the spring had to do a lot with packing plants and vulnerable populations. We had a problem with one of the prisons. Now we're seeing generalized community spread, which to me is more concerning. But certainly we'd always be in communication with all the other resources we have in the community, and the VA's been very gracious to help offer those things in the past, and I'm certain that those things could be worked out if necessary. I just hope they're not. Thank you.
All right, and one last question. In the past week or so, we've seen 2 school districts end their virtual learning and require students to come back to campus. With the surge in cases that we are seeing now and the moving to level red, do y'all have any recommendations for those districts as the medical professionals who are seeing these cases come in and dealing with them, and how bringing all the kids back to campus could create more problems?
I have a comment about that. We've been able to be in communication with the AISD about what they're seeing on the ground and at their campuses. And I think the kids are actually doing a good job when they're on campus. They are complying with their mask wearing. The concerns that we have and the concerns that were conveyed to us was when they leave the campus. And if they're high school kids and they get out to the parking lot and they're going to go to lunch, they tend to jump in the car and take off their masks, et cetera. So those are big problems. It's how do you police that? The other big concern that we've had are indoor extracurricular activities. And we spectators have to wear masks to get into the buildings. But per our discussions, I've been very disappointed to hear that many of those spectators, when they get into the gyms, they take off their masks. And I would remind everyone, as I did previously, that our first cases that we saw here 6 months ago had to do with an outbreak that occurred at a basketball game in a gymnasium. That's the perfect environment for the transmission of COVID, in that it's indoors. You have people that are usually in tight spaces, and usually they're yelling and many times happy and hugging each other. So that's a perfect environment. And so it's not surprising that we would see these kind of problems arise. So it's very concerning to me about these extracurricular activities that are indoors where people are not being compliant with masking.
All righty, that has me covered. Thank you very much.
Thank you, Aaron. We'll now go to David Furtado of KVI Channel 7. David, how are you today?
Doing pretty good. How about you guys?
Very good, thank you.
Good. I just have a couple of questions. The first one is going to be geared towards Dr. Weis. Now, you mentioned earlier that you were flabbergasted with the change in the hospitalization rate calculation and whatnot. So my question to you is you were fired up about it. Do you worry that this this change in the denominator, change in the formula could kind of rush reopening efforts and the excitement and then increase these COVID cases? And are you worried about how people see this new number compared to where you guys actually stand as a hospital?
So the answer is yes, David. I'm concerned this is going to give people a false sense of security that, gosh, the hospitals have lots of capacity. When again, that kind of using that total number of licensed beds, that is not a homogeneous pool of beds that can be used to take care of people related to COVID-19. And so that's the problem. But yes, I'm very worried that we really need to be looking at what is the census in our hospitals. Do we have holds in the emergency room? Because if we have holds in the emergency room, it tells us that census is probably the hospital's at capacity for whatever reason, staffing issues, critical care issues, and that is the more relevant number to how the hospital is doing, as opposed to whether or not we have this huge pool of beds, many of which might be for infants or for behavioral health, or just things that we are not going to be related to COVID-19 care.
Okay, and my last question is for all of the hospital folks. Is now with this change giving a little bit of an unclear picture of how hospitals stand? Would you guys, is there a possibility that you guys could produce your own, I guess, hospitalization rate to give a more accurate picture of how you guys are doing in the area?
Well, I think that this is Dr. Lamentier. I'll say that I think that we've been doing that. I mean, I think that is our goal, was to tell you exactly where we stand, and that is that, again, at 298 total patients today, 28% of which are COVID patients. That is a significant number of our total inpatient census. When you talk about our capacity and you talk about our surge planning, which we've been doing for months, when our total number of hospitalized patients gets up into the mid 300s, 340, we are reaching levels of patients that we are going to be in significant trouble in terms of trying to have nursing staffing, specialized trained staffing, physicians for that matter as well, being able to manage patients beyond that type of number. And that is not close to the number of licensed beds we have, which is 445.
So could we potentially see, you guys just having, in the COVID report card, having like an individual separate calculation separate from GA32's calculation? Could we see that so we can kind of see specifically, how our local hospitals are doing, as opposed to, this new calculation, which kind of may or may not give some folks a sense of false hope?
So Dave, we do have that on the report card. We have our local hospitalization, the adult bed capacity information, and the ICU capacity and the ventilator capacity is already on the dashboard.
Okay. And is that calculation that you just mentioned, Casie, is that the old one from like GA 30 or 31, I believe?
No, so that is totally separate from any of the governor's orders. That is simply a local calculation.
And can you just tell me what that formula is, so I can kind of I guess put that on screen comparative to the other calculations?
So it's just an average of the two hospitals' capacity.
Okay. All right. Super. Thank you guys so much. I appreciate your time.
Thank you, David. Those are all the questions that we had from media at this time. Once again, this is David Henry. I'm the Communications Manager for City of Amarillo. I want to thank all of our panel members for joining us today to provide this information to the Amarillo community. Once again, we do these every Wednesday at 11 a.m. I want to thank everyone for joining us, and we will see you next week.